Well, did you know that 30% of hip fractures result in death? But those numbers can be reduced in patients who are treated within 24 hours and those who are treated and walking within 4 hours of surgery. Well, today we hear from Dr. Jason Welter with the TriHealth Orthopedic and Sports Institute on getting patients mobile and pain-free. Take a listen.
So the most common setting of a hip fracture is an individual who most typically has a fall from a standing height. Usually immediately after the fall, they have pretty significant pain around their hip and groin area. They may have a deformity of that leg, depending if the fracture is displaced or not. And most commonly, the pain is severe enough to where they oftentimes can't get up or put weight on that leg, which usually triggers transport to the hospital for further evaluation. The evolution of hip fracture care over the past 5 to 10 years has really evolved to the point where it's become standardized that the gold standard is to have a hip fracture stabilized within 24 hours to expedite the patient's return to function. So at TriHealth, we have an excellent collaborative effort amongst a whole broad spectrum or group of specialists that all work together to provide good, expeditious, quality care to the patient. We make sure that as soon as the patient comes to the hospital, their diagnosis is made. We make sure that their medical issues are optimized, and we make sure that we get their hip fracture stabilized as quickly as possible in order to expedite their care and return them to their level of function.
Well, for more information on the hip fracture program, go to trihealth.com/ortho. Clyde?